Everybody, this is Dr. Kurt Wohler again. I appreciate you joining me tonight for tonight's webinar titled Gluten Sensitivity, Celiac Disease, and Multiple Sclerosis. We're going to go through some interesting information for you if you are an individual with MS or you know someone suffering with MS. I would highly recommend trying a gluten-free diet to see if it may help some of your issues, because in many other patients it certainly has. And we'll explain why. So before I get started with the presentation, I have been involved in patient education as well as physician education for many years with respects to complementary medicine. This particular website called askthedoctor-ms.com is a direct access website to me through a member forum where you can post questions regarding MS treatment, dietary questions, supplement recommendations, other questions you may have with respects to testing or complementary medicine, whatever may come up. So you can interact directly with me through this website. It's just billed month to month. There's no long-term contracts. You can discontinue at any time. So I encourage you to check it out. You can go to askthedoctor-ms.com. And then if you want more general information about me, you can go to my main website, which is drwohler.com. And there I have a host of links to other websites that I have. I do a lot of work with the autism community as well. Back to links to my main office website for consultations, etc. So drwohler.com. So what are we going to talk about tonight? Well, we're just going to briefly discuss, particularly if you're new to this kind of information, just real briefly about MS statistics and symptoms. Then we'll touch on gluten sensitivity and celiac disease and just some examples of research. What exactly is gluten? What are some sources of gluten? And then make the connection to brain inflammation and something called Microglial Activation and how that can play a role here. And then I'd like to wrap up in something I call the chronic stress response, which is really important in any type of chronic health condition, MS certainly included in that. So I think you'll find that interesting. So, from a multiple sclerosis standpoint, we know that MS is a devastating neurological disease. It affects upwards of 3 million people here in the U.S. and estimated over 6 million people worldwide. And unfortunately, those numbers are growing. There's about 200 new cases of MS diagnosed each week. Currently, sorry about this. Okay, I hit the wrong button. Okay. Anyway, currently the ratio of male to female with respects to MS diagnosis is 3 to 2, but there are more children nowadays as well as elderly individuals who are being diagnosed with multiple sclerosis. And as you know, if you're an individual suffering with MS, or perhaps you're a friend of a loved one or a family member of a loved one with MS, you know how difficult it can be with respects to some of the symptoms that people exhibit. So we certainly know the disease itself is complex. There's really no one cause or symptom associated with MS, except perhaps for one, and that would be heat intolerance. And the heat intolerance with individuals, from my experience with MS, is extreme. It's not, I feel a little tired and I want to lay down, or boy, it's really hot out. It's debilitating weakness and fatigue associated with heat. So that certainly is one classic symptom. And then the overall clinical picture of MS as things progress can range from a broad range of deficits, from numbness and tingling to progression of loss of sensation, weakness, spasms, paralysis. I see a lot of people with cognitive impairment, individuals with bladder issues, incontinence, bowel problems as well. So it can be sort of a wide sweeping array of things going on neurologically and physically. Well, how does this then relate to gluten sensitivity? Well, it turns out that there's a lot of research, and what I did is I picked a few research articles. This particular one is out of Israel for the Centers of Autism Diseases back in 2009. And it was talking about, was gluten sensitivity in MS, is it just a myth, or is there really any clinical truth? And what they found is that they actually found elevated or significantly elevated titers. Titers are a blood test that measures an immunoglobulin response, in this particular case an immune chemical called IgG, an elevated titer against gliadin, and we'll define what gliadin here is in a second, and something called tissue transglutaminase in individuals with multiple sclerosis. Gliadin is a subfraction of gluten. It's a specific type of protein. And then the tissue transglutaminase are enzymes that are involved in processing gliadin within the body. So what they found is a significant elevation of this IgG reaction to gliadin and tissue transglutaminase, which is specific for individuals with gluten sensitivity in individuals with multiple sclerosis. So there was a, even though the researchers weren't able to say for sure, what was the specific role of these antibodies in the pathogenesis of MS, but it was clear that individuals who, or they felt anyway, for individuals who had these blood test markers, that trying a gluten-free diet was certainly worthwhile. There was another study out of Spain that looked at MS and celiac disease. Okay, so I'll define here briefly what the difference between gluten sensitivity and celiac is. And what they did is they did a celiac blood test, which primarily are transglutaminase, what are called anti-reticulin antibodies, as well as looking at antibodies to gliadin itself, in addition to getting bowel biopsies. So they actually went into these patients, 72 MS patients, and took little samples of tissue in their digestive tract to see if it matched criteria for celiac disease. They also did that in 126 first-degree relatives and 123 control patients. And what they found is that approximately 11% of the MS patients, compared to 2.6% of control individuals, had criteria for celiac. So the celiac diagnosis from that study came up much more prominently than in control individuals. What was interesting is they also found it about 32% in the relatives. So all of the MS patients found to have diagnosed celiac disease were put on a gluten-free diet, and essentially all improved considerably, both with respects to their GI problems, whether that was constipation, loose stools, gas, bloating, pain, and also their neurological symptomatology improved as well. So that this study backed up the previous study that if you have suspicion of celiac, or even just gluten intolerance, then trying a gluten-free diet for at least 2-3 months certainly can be worthwhile. So I mentioned gluten intolerance and celiac disease. Celiac disease is a little bit more difficult to diagnose because you have to have blood markers for transglutaminase, you have to have blood markers for IgG reactions to gliadin. Many times a gastroenterologist will also want to get biopsies of the intestinal tract to really sort of clinically define celiac disease. But I can tell you, having been a complementary medical physician now for many years, if you do a test and you have an elevated antibody like IgG to gluten, and you've got any type of bowel problem, body pain, joint pain, neurological issue, then you're minimally gluten sensitive, and essentially the treatment's the same. The treatment is avoiding gluten, whether you have full-blown celiac disease or just diagnosable gluten intolerance, avoid gluten. That's the treatment. So what is gluten? What is gliadin? Gluten is a protein fraction of certain grains. It's important to recognize that not all foods with gluten have what's called gliadin. We'll go into that here in a little bit. There certainly is genetically predisposed individuals. Many people of European, Northern European descent tend to be highly reactive or more reactive to gluten, in quote, grains. We know that the gliadin fraction of gluten it generates an autoimmune process, auto meaning self, immune system meaning it's attacking the body. And the important thing here is that a gluten reaction, or what we should call a gliadin reaction, is not an allergy. It's not being triggered by an IgE chemical that stimulates, an allergy chemical of histamine. It's truly an autoimmune reaction. Okay, and we certainly know that it can be a major cause of clinical or subclinical, degenerative diseases. As a side note, and I'm not going to go into it in depth here tonight, but as a side note, many people with neurological problems, okay, whether it's individuals with MS, people with Parkinson's, Lou Gehrig's disease, autism, sometimes mental health disorders, they have an increased sensitivity to glutamine, or what are called glutamates. These are chemicals that come from different foods, and they can cause an excess stimulatory effect in the nervous system that can damage brain cells. Well, it turns out that certain amino acid segments within the gluten protein are made up of glutamine. So we're not always talking about an autoimmune or an inflammatory reaction to gluten. Some people actually have a chemical sensitivity to it. Okay, so what are some sources of, well, first off, let's take a look at this chart here. So we have a grain flour. About 70% of it is starch. 1 to 2% is fat, and another 10 to 15% is moisture, water at some point. About 16% of the grain flour is made up of protein, and those are broken down between albumins and globulins. And about 90% of a gluten grain like wheat is made up of gliadin and something called glutamine. So what we're talking about with respects to celiac disease is we're really forming an autoimmune reaction to gliadin, the subfraction of gluten. We often talk about glutenins, and that's what people think of when you're talking about avoiding wheat or gluten-containing grains. But really what we're getting at is that gliadin chemical, okay? And if we come over here, there are different chemicals that are found within wheat, rye, oats, and barley that have a similar amino acid appearance to gliadin. And this is why individuals who are celiac or individuals who minimally are gluten intolerant will also be reactive to wheat, to rye, to barley, and most of the time to oats as well, although oats is a little bit debatable. My recommendation is if you're looking to go gluten-free per se, that you also avoid oats at least for the first few months. Okay, so wheat, rye, oats, barley. And there are other foods on this list too that some people are reactive to. And the reality is that as time has gone on, a lot of the food that we eat, particularly the grain products, the breads, the pasta, etc., are much more gluten containing than they used to be. And so the gluten content is much higher than it was many years ago. And we certainly know that gluten sensitivity, well, let's just talk about it from the standpoint of, when I say gluten sensitivity, I want you to think also celiac, okay, so the spectrum. So gluten sensitivity can lead to malabsorption problems. It can lead to problems in the digestive tract that cause inflammation? Well, there certainly are other things that we know can lead to malabsorption of nutrients. Bacterial infections, autoimmune disorders of various types, blockages within the common bile duct or the pancreas. All of these can certainly lead to a problem of malabsorption, which is an issue just from the standpoint of not being able to absorb nutrients. But within celiac disease, or i.e. gluten intolerance, what happens over time is it causes a destruction of the surface lining of the gut, and we start to obliterate the cells of the digestive tract that help to release enzymes, help to produce immune chemicals to help fight infection, and this leads to a whole host of issues of malabsorbing nutrients, fats, proteins, carbohydrates, and also destroys the immune system of the gut, which increases our potential for infectious diseases. The problem with causing a destruction along the surface lining of the gut is that we now start to create a permeable environment where bad things are now gaining entry into our bloodstream and not necessarily being eliminated in our stool, or what we call leaky gut. And leaky gut, we know, can be another creation, if you will, of inflammation and another trigger for autoimmune disorders. This slide is interesting just from the standpoint of what happens to individuals, and this was 90 patients who were just put on a gluten-free diet, and what happened with many different blood markers. And as you can see, the normal diet was they were eating gluten. The gluten-free diet, obviously, they had taken it out. I don't remember the time frame of the changes here, but this is kind of a typical thing you might see over a 3 to 6 month period of time. And if you just look at the hemoglobin level, significant change from abnormal to normal for male and female. Iron levels increased, B12 levels increased significantly. Fecal fat went down, because that's one of the things that happens with celiac disease is the lining of the gut starts to become damaged and you can't absorb fat. And an overall improvement in the ability to absorb lactose or milk sugar. So if we just hone in a little bit closer here when we're talking about the surface lining of the gut, what we call the mucosal membrane, these little finger-like projections are what are called villi, and these villi are lined by cells, and these cells could be releasing digestive enzymes, they could be releasing mucus, they could be releasing immune cells, and these things become damaged over time. And when these things become damaged, these little spaces in between these cells start to open up, and that's what the leaky gut situation is all about. When we start to have these spaces open up, we now have bacteria and yeast and other toxins from the gut start to gain entry into the bloodstream, and that can create autoimmune problems. And this is just a closer up viewpoint here of a particular villi. And as you can see here, as these things become damaged, we're going to have a whole host of problems. Now, the reason I bring this up is that we also have a permeable or a semi-permeable membrane, if you will, or a protective barrier in the brain itself. So you have to think of the surface lining of the digestive tract being a semi-permeable membrane. It allows certain things to be absorbed. It lets the good stuff in and keeps the bad stuff out. When we have a lot of inflammation and damage in the gut, we'll have a leaky gut situation happening. Well, here on the slide, BBB, blood-brain barrier, we also have a barrier that surrounds the brain. Essentially what this barrier is doing is it's surrounding all of the blood vessels that are flowing up into the brain. And that barrier is to allow the good stuff in and keep the bad stuff out. But it's known that there are things that can trigger immune reactions to the blood-brain barrier. We know that food reactions can do it. We know that infections can do it. We know that heavy metals can do it. Chemical toxins can do it. And so anytime you're creating damage of the blood-brain barrier, essentially you're getting a leaky blood-brain barrier, just like you get a leaky intestinal tract or leaky gut. And why that's important is there are immune cells in our brain that are responsible for keeping everything healthy and intact. Astroglia are these cells that keep the brain supported. The astroglia help produce that blood-brain barrier. But it's the microglia that are most involved in the overall immune response in the brain, and it's being found now that in many different types of neurological disorders, microglia are becoming activated or they're becoming chronically turned on, and when they're chronically turned on and activated, that generates inflammation and damage. And so you can damage myelin, you can damage adjacent support cells in the brain, and you get degeneration and damage throughout the brain by inflammation. And this is happening now or being researched in many different types of disorders. And there are many triggers for it. Okay, so we certainly know that chemical substances might do it, viral issues could do it, bacterial toxins, food reactions can certainly do it. Outside, chemical exposure could certainly do it. We've certainly seen in autism that it's been suspected that certain vaccines might trigger it, whatever it may be. But we have this situation of what's called microglia activation causing cyclical inflammation and damage within the brain. And so the emphasis here within this presentation is yes, there is a potential that gluten could not only create a problem in the gut, damaging the gut from just an absorption standpoint of nutrients, but also causing a breakdown of the gut lining leading to leaky gut, and also then causing a cross reaction in the central nervous system leading to inflammation in the brain and either contributing or certainly worsening the symptomatology of MS. Now, to wrap this up, I always tie this back to what I call the chronic stress response. And the chronic stress response is simply put that when we have chronic stress, whether it's mental, emotional stress, physical stress, environmental stress, chemical stress, whatever it may be, the body's interpretation of that stress is the same. It's inputted through the brain. The brain is then outputting chemicals that talk to our adrenal glands. The adrenal glands are then involved in producing cortisol, that natural anti-inflammatory in our body that we all need. And over time, the cortisol and the adrenal glands become weakened and stressed. And when that happens, we run into a whole host of issues, from diabetes and heart disease to blood sugar problems to osteoporosis to a breakdown of the immune system. And when we start to have a breakdown of the immune system, we start to have an increased potential for autoimmune disorders, a weakening of the immune system, and a whole host of physical and neurological problems that ensue from that. And as you can see, from a hormonal standpoint, the body is relegated to try to create a balance of cortisol, to try to keep balance of all of the hormones in the body. And when we are under a chronic state of stress, this red arrow is indicating that the body's preferential pathway is to support cortisol, but unfortunately that leads to other imbalances in the body, whether it's aldosterone that regulates sodium and potassium levels in the body, which can lead to weakness, progesterone, estrogen, certainly testosterone, leading to sex hormone problems, particularly as people transition through different stages of their life. And so this just indicates that these chronic stressors, including gluten intolerance, can be one reason that people are having problems hormonally from an endocrine system and from an ability to keep things in balance as much as possible. And then finally here, when we do not have a balance between these systems, we have a whole host of issues, from the nervous system to controlling inflammation to controlling thyroid. I see a lot of individuals with MS who also have thyroid problems, to not being able to detox toxins out of the body. It all sort of feeds back to this balancing system. For those of you who are not aware, there's an interesting organization called direct-ms.org. There's a woman by the name of Ashton Embry, PhD, who started this organization, and she has been researching the idea that food can be a triggering problem in individuals with MS, and also eliminating certain foods that tend to stimulate the immune reactions in the body that damage myelin through this cross-reactivity potential can certainly be beneficial by removing them. And the best bet diet essentially is looking at, initially trying to remove dairy products, remove legumes, beans and peas, reducing or eliminating refined sugar, limiting eggs, limiting yeast, and lo and behold, also avoiding all wheat, rye, and barley, or any products that contain gluten. So again, you can go back and reference this from direct-ms.org. And then finally, Great Plains Laboratory, who is so generous to allow us to use this recording system through GoToWebinar, is a great lab. They have a tremendous menu of different lab tests. And one of the tests that I commonly do in anybody I see, whether it's an individual with MS or chronic fatigue or a person just wanting to improve their overall health, is a food IgG sensitivity test. And that test is important because on that profile, it actually evaluates immune reactions to wheat as a whole complex, to gluten, as well as to gliadin, and it looks at many other different foods as well, corn and rice and fruits and whatever it may be. So I highly recommend doing a food IgG sensitivity test from Great Plains. They also have an IgE allergy test, but to be honest with you, the vast majority of people with MS and other chronic illnesses, it really truly is the IgG chemical that is causing this low-level inflammation and problems. And as I mentioned before, you can also do tests that are really more specific for the potential diagnosis of celiac disease. And that's where you do something called a total IgA. You look at what's called the transglutaminase enzyme. You look at anti-gliadin IgG and IgA, and that helps to sort of fine-tune the diagnosis more towards a diagnosis of celiac. But I have to tell you, and this is an important part of this because I know this can be confusing, you actually can do the food IgG sensitivity test from Great Plains. And if your IgG comes back high for wheat, gluten, or gliadin, you're minimally gluten sensitive. Okay? It doesn't mean that you have celiac disease, but you minimally have gluten sensitivity. From my perspective, from the time involved, etc., I personally would look to try and implement a gluten-free diet for at least 90 days and just to see how you feel. And I've had a lot of patients do that and they feel much better. For additional information with respects to, really MS in general, whether it's additional medical information with respects to multiple sclerosis, lifestyle factors, personal growth, finance, etc., please visit the good people at msrelief.com. And these webinars that we do are hosted off their site and other articles too. And then, of course, as I mentioned in the beginning of this presentation, if you have additional questions that you would like answered, questions with respects to complementary medicine, for all topics related to MS, then please visit me through the member forum at askthedoctor-ms.com. And with that, folks, I appreciate you joining me tonight. I hope you found the information useful, and we will see you next time. Take care.